We are not investing in Africa for the world, we are investing in Africa for Africa, and then from there we can go and reach the world. Zambia has always been welcoming investments, and I think it is one of the most safe countries in the region. I also believe that Africa as a continent represents the future for the whole world. Grabbing the opportunities is very important to everyone, especially to the youth. The idea started with having an advanced diagnostic center in Zambia. The question was, why do we really want to invest in diagnostic centers? If, for instance, a patient is diagnosed with a condition, we cannot treat that condition. So it was very important for us not only to diagnose, but also to provide the treatment for the patient. The key, I think, is building a team, a strong team, and believing in that team, trusting the team members, advocating for their continuous training, education. It is our obligation to provide them with the tools so that they can learn and then be up to the scale.
So Medland Hospital has taken many years to come to fruition, and here we are today. How do you feel walking through the corridors? Your dream is now a living reality. How do you feel about that?
We are definitely very proud of this investment, not only as a family business, but also as people coming from the healthcare sector. So I feel proud, but also it triggers me and it tells me what's next. What can we do not only to improve ourselves, but also to encourage others to invest in the healthcare sector or in any other sector, so that not only we will have one Medland hospital, but we will have many across the country and across the continent. We have seen that there is a rise in the numbers in non-communicable diseases in Africa. One of those diseases is diabetes, and it comes with a lot of other comorbidities. Honestly, it's frustrating for a patient to move from one clinic to another, so we have created that clinic. In a way, a diabetic patient or a patient at risk of diabetes can access that clinic and being served from there by everyone. Another initiative of ours is the Actual, which is more internal. It's the awareness and continuous training unit. Always tend to raise the awareness among the general population. One of the challenges that we do face in the healthcare sector in Africa and in Zambia indeed is the fact that we lack specialized manpower. We have a very, I will use the term strict, a quality assurance department that works hand in hand with every single person and colleague in this facility to ensure that protocols are being applied on a daily basis.
So Dr. Mohamed, you're providing excellent strategic planning and strategic management to your teams and the staff. Do you still manage to practice in all of that?
To be honest, I do practice very rarely because of time. When needed, if needed, especially in cases of emergencies, I'm available.
What is the vision of Medland Hospital, and how are you strategically positioning it for the market?
I think it's unfair to compare healthcare facilities. Some may have advanced technologies, some may have experienced, skilled doctors, nurses, and team members. I think we are all here to provide a quality of care to everyone. Medland Hospital has brought in services that were unavailable in the private sector market, not only in Zambia, in the region. Medland Hospital value is more of a moral value. What has Medland provided and did in 1 year and a half in times of COVID-19, which was not an easy period to cope with, I can easily say that today our value has jumped up to $75+ million.
Some call you the business wolf after having acquired Fairy Bottling. How does that make you feel?
That title came after the acquisition of Fairy Bottling by Coca-Cola Beverages Africa. It's a nice title, but I think it's also a very challenging title, because being a wolf does require transparency, does require accountability, but also does require firmness. So for instance, in the healthcare field, being a wolf, what does it mean? How do we make it happen for a new brain drain into the region? How do we make it happen to attract investments in pharmaceutical industry, in healthcare business? COVID-19 again was not an easy task for everyone, especially for the people who are in the healthcare industry. I do enjoy reading a lot. It's not a hobby, I think it's also a responsibility. The book that I have finished lately was the book of Vice President-elected Kamala Harris, The Truth We Hold. We have a helipad just behind this building that is meant to welcome patients from other provinces as well as patients from the neighborhood countries when need is. I go there because it is rare that people can find you there. They don't expect you being there, and it also increases my pride about Midland Hospital and triggers me for new initiatives for the future.
You talk about Zambia like you've been here forever. Would you like to tell us about your country of origin?
Lebanon has succeeded in exporting skills. Lebanon has participated in rebuilding and building areas and countries across the globe. I talk about Lebanon with bitterness, sadness, and I don't think that Lebanon as a country deserves the present that will be written as its history, sadly.
Lebanon has had many challenges in the recent past, and some of those, yes, being with regards to debt servicing. And these are challenges that are being faced in many different countries around the world, and Zambia is no exception, especially with regards to debt servicing. How do you feel as an investor right now, and what is your word to other investors, even those outside the healthcare space?
I am not defending any government, and this is not specific to Zambia or Lebanon. Recently they have both defaulted, but debt reflects the level of infrastructure and development that is there. Corruption has participated in continuing indebting the country. We did not work on our industry, on our agriculture, on our economy. It's unfair to treat Zambia as a defaulting country, which has happened again in times of COVID-19. And again, I repeat, I am not defending anyone. I'm just saying that we have to look at the current situation from another perspective, bringing in together the private sector and the public sector so that they can work together to improve the economical sectors that will allow us to reach the 2030 agenda, 2039 and 2065 agendas.
And finally, what is the next level for Dr. Mohamed Sahili?
Next level is one, in the healthcare field, to set Zambia as a hub for medical travel and medical tourism in the region. We need to fine-tune our tools and to work on empowering all the sectors so that we can welcome patients from abroad. The other next level is advocating for turning our words into concrete acts. It is time to work to link people together. COVID-19 has been a great example to show us. If we work together, we can overcome all the challenges. My mission, my goal, is to turn those words into concrete actions. We have set a vision to our group called 853. And that vision applies to any company that we do run. It is a vision that takes into consideration the progression and the expansion within 3 years, 5 years, and 8 years. And this is what we plan to do at Midland and at any other company that we may run.